Hello everyone, welcome back to my channel. My name is Laurie. If you are new here, I am a family nurse practitioner. I talk a lot with my hands. Scratch that. What is up everyone? Welcome back to my channel. My name is Laurie. If you are new here, I am a family nurse practitioner, and today we are going to talk all about resources if you are a nurse practitioner student or a nurse practitioner. I'm going to share with you guys probably 6 to 8 apps that I used when I was a student, all the way now to I am a nurse practitioner practicing. I have been practicing now for 2 years, and some of these apps I still use. Let's get into these apps. Oh, don't forget to subscribe to the channel and also click your notification bell so you are notified every time I do upload a video. So app number 1, this is how my apps look. I set them up really nicely on my phone, and I just have NP resources so that it's easier for me to find them. The first app that we're going to talk about is UpToDate. Honestly, I think that if you have UpToDate, you really don't need a whole bunch more because there's so much stuff in UpToDate, but UpToDate is not free. UpToDate is $57 a month and $560-ish per year. The hospital that I am affiliated with, I can use it because of course the hospital provides this for their staff. So in UpToDate, you are going to find a ton load of information. You have different specialties in here: dermatology, general surgery, hospital medicine, infectious disease, palliative care. Everything at your fingertips. I will use this a lot too when I'm in the hospital, because you guys know I do round in the hospital. So I'll quickly look stuff up when I simply don't remember and I'm like, oh, what is that again? I can quickly look it up in UpToDate. So UpToDate is a good app. The next app that I use a ton is ICD10 Code. Now I think I shared with you guys before about ICD10 Code. If you are a nurse practitioner, you work in primary care, like if you work for these primary care physicians, some of them you have to do your own billing. I don't do my own billing, but I do have to write down my ICD10 codes. So I'll write my patient's name down and I'll write my ICD10 codes down for what I am billing my patients about. So ICD10 code is just how the insurance company pay you. Every single diagnosis has an ICD10 code. The next app that I will share with you guys is this American Diabetics Association Standards of Care. If you are kind of struggling with managing your patient's diabetes, this is a good app for you to use. You have general information in here. If you go ahead and you will click on glycemic targets, you click on A1C target individualization, ask you different questions to individualize your patient and how to treat them. The next thing that I like about this, it talks about different comorbidities when it comes on to managing your patient's diabetes. So check this out if you are having any form of difficulties with managing your patient diabetes. There's another app that you can check out as well that's called the AACE, Comprehensive Type 2 Diabetes Management, and it's basically an algorithm that you use for your diabetic patients. So you have your pre-diabetic algorithm and your glycemic control algorithm, and it will help you with managing your patient's diabetes, whether you're using PO glycemic medication or you're using insulin. So check that one out as well. The next one, geriatrics at your fingertips. Now geriatrics at your fingertips, I use it because my primary patients that I see are older adults. They're geriatric patients. I don't go into the office that much. So of course in the nursing home, this is the patients that I'm caring for. So geriatrics at your fingertips actually gives you a lot of guidelines and a lot of different things for your older patients. Say for instance, you want to look up delirium in your patients, diagnoses, causes. It tells you how to manage it. If you scroll down, you have depression, eye disorder, fall prevention. Fall is such a big thing with a lot of these geriatric patients in the nursing home population. So I like this app because it really tells you how to manage a lot of different diseases, ailments, and different things that happens with your geriatric population, especially if you're a nurse practitioner and you're in the nursing home setting. Next app that I'm going to share with you guys is Hypocrites. There's a free version and there's a paid version. I think Hypocrites, you have to pay $17 a month. I only have the free version. Any one of these that are locked diagnoses, labs, alternate meds, anything, you cannot open these because you have to pay for the service. See, it's going to pop up and it's going to say $16.99 per month. You have other resources where you can look up other things. The next app that I will share with you guys that I use is Sublux. So Sublux is for x-rays. This helps you out a lot. This thing is amazing because if you click on describing fractures, describing you what a closed or open fracture look like, transverse, spiral, oblique, all of these that we learned that we probably have forgotten, it is right at your fingertip. Basics of plain x-rays. This will be great if you are in like an urgent care setting and you have an x-ray machine in there and you don't really know how to look at x-rays. This will kind of help you out a little bit. For me personally, when I send my patients for x-ray, of course in the nursing home setting, the radiologist is reading the x-ray and writing out what is going on. Next app that I use is, I use CDC sometimes when I want to look stuff up per CDC guidelines. Next thing that I will share with you guys, coverage search. Big thing is patients sometimes have issues with the coverage from their insurance plan and what formulary we can use to substitute. So this is pretty good for that. So if you're an NP in the primary care setting and you kind of want to look up a medication to see if the insurance will cover it, this is a pretty cool app for you to use and see what formulary and what can be covered for the patient's insurance. There's another app that I use and it is 2020 Goal, and this is for COPD. So it's a global initiative of chronic obstructive lung disease. And this is good because I'm telling you, I have so many patients with COPD and trying to manage their COPD. And one of the big thing is these inhalers. There's so many of these inhalers that it will make your head spin. So I like this because when you click on the maintenance medication and all of this, so you wanna find out about beta 2 agonist. Beta 2 agonist duration, you want a long acting, or you want to select a drug. It's basically telling you the medications right here. So say I click on formoterol. It tells you it's delivered as a nebulizer and duration of hours is 12 hours. If you click on the PDF, the PDF is telling you everything you need to know about this inhaler. So this is a very quick resource that you can use for your COPD patients. And I'm telling you, you're gonna have so many patients that have COPD, so this is going to be a definitely cool app for you guys to check out. So those are pretty much all the apps that I currently use as a nurse practitioner in my practice. I'm pretty sure that there's a lot more apps out there. I really try to keep it simple. This is actually a lot of apps, so it definitely helps me caring for my patients so that I can have the right and correct information right at my fingertips. And we are on our phones all the time anyways, and I prefer to have these apps instead of having books. I am going to do a separate video about different books and stuff that I think would be essential as well for you guys if you are a book person, you want to turn the leaves, especially if you're at home and stuff, you want some books for your library. Let me know in the comments if you use any of the apps that I probably should check out. I hope this was helpful for you guys, and as always, don't forget to like, comment, and subscribe to the channel, and I will definitely catch you guys up on my next video. Bye guys.